We'll be able to turn that.
So, wait, is Mr. Prakash here? Oh, that's unfortunate. He would have enjoyed this. So, on Friday, Sanjay Prakash told us to dream big. That's exactly what our team did. We set out to change the world. Now, our vision was to tackle prescriptive medication non-compliance by changing the way the world views prescriptive medication. We are Medella.
So what exactly is prescription adherence or medical adherence? It's adhering to the timing, dosage, and frequency of the medication as your doctor recommends. And right now there's two problems. One is that 30% of prescriptions are not even filled at all. And then out of those 70% that are filled, only 50% are used as scheduled. Now, this is causing horrible, horrible effects. Is that it's linked to 125,000 deaths, this non-adherence. It's a $289 billion cost to the healthcare system and more hospital visits for these patients, more doctor's visits. And it's costing pharmaceutical companies $188 billion in lost sales because these prescriptions aren't even getting filled, or if they are, they're not getting filled through completion. And this is a growing problem that you can see the cost is growing 10% a year since 2005. And the revenue is growing at an astounding 33.5% loss since 2004.
So our first task was figuring out what was the reason behind non-compliance, what was going on, what are the whys behind it. And after extensive research, we came up with 17 root causes, and our app focuses on a number of them. So we focus on expenses, illiteracy rates, both in English or illiteracy in general, a lack of knowledge, or medical cognition, and finally a weak support system. And so we have a three-pronged approach to solving these issues. The first is an educational reference library. You can look through a database of prescriptive medication, and on hand, on your app, you will have the description of the medication, what it does, the side effects. If expense is an issue, it'll have the generics and the costs that come with it. And also to tackle literacy, now we'll have a Spanish literacy option or an audio option. The second is a notification system. The physician's office will put in the prescription medication into the app. It'll put in the dosage and the frequency in which you need to take it, and then it'll send you push notifications to remind you to take your medication. And finally, we have our most important feature, a family and peer-to-peer support network. Now, with the family feature, you can connect to other family members through the app. And what that means is that if you don't follow a prescriptive medication, if you don't follow your doses, your family will get a notification. And they'll get a push notification, and they can remind you, hey, what's going on? Are you sticking to your regimen? Is something wrong? Can I do anything to help? And second is a peer-to-peer support network, an online, completely anonymous forum where you can connect with others that have been through the same condition as you, taking the same medication. You can ask questions, you can connect, you can have this sort of community based around medication.
So when we did our market analysis, we saw that the comprehensive reference library and the peer-to-peer and family support network was going to be the area that hasn't been tackled yet by the competition. Most of these apps right here remind you or give you a pretty cool layout on how to take your medications, but this is something that hasn't been done yet. And interaction with peer-to-peers and with your family is going to help the patients adhere to their medications because it's a huge positive social encouragement and influence. And so we saw 4 different revenue opportunities. The first one through insurance companies. If patients adhere to their medications, they're going to see a reduction in hospital readmissions. The second one, through pharmaceutical companies. If people stick to their medications, they're going to be able to sell more meds. The third one through partners. So say we partner up with WebMD to provide content. We're going to increase lead generation and increase traffic in their site. And the fourth one by automating different processes that are still pretty archaic in the system. So Sergio's going to talk to you about the app. All of us met on Friday. We had no idea who was. And so it's pretty impressive what the two tech guys have created.
So basically, due to limited time, we couldn't actually design a framework so you can see on the screen. But one of the judges, I will just like go. Wait, where's oh, there you go. So basically, this is your initial screen. If you can see it, just to log in like a regular startup company. You log in. Gmail will be.
I'm sorry, you'll have to use your Q&A time to present your 5 minutes. So.
Okay.
Oh,
Perfect, thank you. So yeah,
Thank you.
any questions, the judges? Oh, that's pretty clear.
oh, okay.
Oh, yeah.
Gmail. So we have a user authentication, so it's pretty secure. We're using Amazon Web Services.
Does anybody in the audience have?
No, this
Well, let's go down.
Sorry.
Yeah, do that.
Well, always preparing on that, you expect, you could have an API that link with a variety of other systems, so you can augment caregiver provision. In your provider side, you've got the insurance, the payor community, but the provider community itself has a strong interest. Hospital readmits are a key part of this too. It's not just the payor that's interested in this stuff.
That's good.
So you can say that I set up a time that it's time for me to check the information. So if you send me a push notification.
So initially, the dashboard would have when is my next. The doctor would put all this information on the portal, and then the portal would push data to the app itself, and then we would tell the client, hey, when I need to take my medication, and then it would send them out a push notification to the user. And you can incorporate this to smartwatches, the Pebble Watch, the Apple Watch is going to come out next year, and
If you guys talk to any doctors, I'm pretty familiar with the workflow, right?
Yeah.
And we have, I work with another company that does some similar stuff, but not exactly what you guys do. And they find it so difficult to just get either a nurse practitioner, a nurse, or the doctor to get the data into a separate service because those people are so busy constantly trying to do the things that they have to do to provide good quality healthcare to people. So how do you guys?
So we're lucky enough to talk to the director of the MROR yesterday about this issue. And his thought was that now as more and more nurse practitioners are working in the hospital, that they're much better than doctors, these are his words, not mine, at filling out, people into a system, people into these databases. So his thoughts were that it's definitely feasible if you can get the nurse practitioners on board. And he said the hospital, they're incentivized to do this because right now, 25% of records are going by phone or fax to CVS or whatever the end pharmaceutical retail location is. That's a very labor-intensive process. That's dollars and cents for the hospital. So if that's automated, that's an incentive for them.
What's your immediate target market?
Our immediate target market is the insurers. We believe that's where we're going to have the insurance companies. I'm sorry, because
Users. I need to use this app, right?
so anyone that is having a chronic illness, there's 141 million people in the United States alone with a chronic illness.
So what's the role of the friends of the family to notify me to take the medication?
The role of your family is, so say that, my grandma, she's sick, and she signs me up as a friend on the app. I can see that she's not taking her medicine, and I can call her on the phone and say, hey, grandma, you should really take your medicine. That would be the role.
The thing is, the doctor is entering this information. Mrs. Weinstein,
She would have to.
She's going to have to sign this paper to grant then the right
Yeah.
to share this stuff.
yeah, but at least you have an option to do that.
It would be her option.
And we can anonymize the data. So you only know that your grandma didn't take the medicine. But
Thank you.
Thank you very much.
Okay.